Otoplasty is a procedure to reposition protruding ears. Many people go through their lives with ears that stick out a little further on their head than they might wish. And some people do quite well with this, but some people are very self-conscious. This can occur in men and women, and it can be present in a problem at any age, usually beginning in birth and continuing throughout life. Now, in very small children, shortly after birth, sometimes some taping procedures can be used to get the ears to form and settle more closely to the head. But once you're out of infancy, it's very difficult to get the ears to reform, and that usually requires a surgical procedure. Who is a candidate for otoplasty? Well, no one needs an otoplasty. It's the patient that is self-conscious about the position of the ear as it sticks out from the side of the head. The literature says that young people can be done sometimes as early as 6 years of age. I personally don't like to do it then because the ear cartilage is too soft at that point. I think it's best to wait until the ear cartilage has firmed up a little bit. I like to wait at least until the patient is around 9 years of age. On the other end of the spectrum, there's no age limit to when ears can be repositioned. We often do this in adults in their late teens, 20s, 30s, and even into their late 60s and some in their 70s. A lot of people, when they're very young, especially females, can cover their ears with their hair, and when they do that, they can hide the protruding ear. So oftentimes we'll see someone that's coming in for another procedure as they are older in life, and they'll say, oh, by the way, can you do something about my protruding ears? Or when they're having a facelift and their hair is shorter, they may want to do it at that time. Now, how is the procedure done? It's done mainly by giving a patient some light sedation and then putting local numbing medication around the ear. And you can't feel anything with this procedure when it is done like that. We go behind the ear and make an incision and take a strip of skin, and we use various maneuvers to rotate the ear back into what the patient may feel is a more normal position and angle from the head. And then after we're finished, we put sutures in the skin and close the wound. After care, the patients need to be careful for just a little while. We'll have a dressing overnight, and then we ask them to wear a headband every night and during the day, really for the first week or two. After they're out a couple of weeks from the otoplasty procedure, they can just usually wear the headband at night when they sleep. It takes a few months for any wound to heal, so there can be some firmness in the incision behind the ear. But after a few months, when the firmness goes away, the ears will usually anchor and stay in that position. Complications that can occur are rare. Infections are possible with any type of procedure. There are antibiotics that we use to try to prevent problems from any kind of infection. If a patient plays contact sports and gets a pull or tug on the ear before it's had time to heal, then it can pull it out from the head and pop one of the stitches. Or if they roll over at night during the sleep and catch their ear on a pillow the wrong way, early on in the healing process, it could certainly pop one of the stitches. But the solution is usually very simple and easy. We just numb the ear up, replace the stitch, and tighten it back in position. This is Dr. Philip Langsdon at the Langsdon Clinic in Memphis, Tennessee.